Thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today's episode, we have Dr. Rachel Kuperman from, is Eysz? Am I saying it right?
Eysz, that's right.
Eysz. I like how you have it spelled too. You'll have to, what's the exact spelling of it?
It's Eysz, and it's I plus the abbreviation for seizure. So it's Eysz.
I like it. Yeah. And people will see your logo, pretty cool logo. It's kind of like this, it's almost like a technology looking, is that what you were going for with it?
Eye brain.
Yeah, it's pretty cool. It's pretty cool though. They'll see it. Love the color purple. One of my favorite colors. I'm a big brand person. I like reading about new companies and learning about, what they're doing. But the first thing that draws me to them is, do I like the logo? And I will say I tend to give the ones that I like the brand and logo to a little more extra time because it catches my attention. So you pass that part of the equation. And
Excellent. I'm
excited for us to chat.
It's great to be here.
I'd love if you kind of kick things off. And just so the audience knows, you're traveling right now. We're actually this is the first time this has really happened besides when I had a conversation with the head of innovation at Tampa General, that someone's actually in the same area technically, because you're at an event down here. But I'm excited for us to chat. I'd love for you to kick things off by telling the audience about your background, and then we will go into more about Eysz.
Great. So my background is I'm the child of a scientist, and science was always kind of the be-all, end-all in my life. And I did my undergraduate training in physics, very technical oriented, did a neurology, pediatric neurology fellowship, epilepsy after that, and then went on to run the epilepsy program and clinical neurophysiology program at UCSF, Benioff Children's Hospital in Oakland. And as someone that has lots of technical expertise, really kind of taking ownership of patient care was a very eye-opening experience. All the technical experience in the world isn't going to help you kind of communicate and advocate. And it's really a skill that I needed to learn after I started. And ultimately, that's what led me to found Eysz.
Interesting. Yeah, you do have a very technical background, which honestly, for the space that you're in too, is very much needed, especially to really create a great startup. I want to focus in on this problem. This was one of the things that you and I chatted about when we were kind of preparing for this podcast. Is you have some stats in kind of your deck, I guess, that kind of lays out how big this problem is. Can you explain to people that maybe aren't too familiar with epilepsy how big of a problem it actually is in comparison to some of the other things that we kind of focus in more on in healthcare?
Yes, so epilepsy is a neurological disorder, which is characterized by recurrent, unprovoked seizures. And many times it's accompanied by cognitive challenges, which can be worsened by medications and treatments. So epilepsy in the United States has roughly 3.4 million people who carry the diagnosis, 150,000 new diagnoses per year, and $28 billion of direct medical expenditures. And when you put it into the context of other disorders, there's more people with epilepsy than with autism, cerebral palsy, and multiple sclerosis combined. So I think the stat that always kind of takes my breath away is the one that's published by the Epilepsy Foundation, which is 1 in 26 people have epilepsy. And it's interesting because when you talk to people about it, they say, oh, I don't know anyone with epilepsy. I said, no, I bet you do. Go back. And sure enough, most people have a friend of a friend or a relative who has epilepsy. Oh, and just the last point is that it kind of speaks to the stigma of it, the fact that we don't really know the people who have epilepsy or understand how many people that surround us have it. Really speaks to the fact that it's just not talked about. There's still a lot of stigma associated with it.
Yeah, I think back. It's either a friend, a family member, or a friend of a friend, right? But you're right. I feel like people too that have epilepsy, it's not something that they come out and talk about all too much. Why is that? Why is there a stigma associated? Can you explain more about that too? Because I think it's also important if we can create maybe a better environment to talk for people that have it, to talk about it. It will also provide that additional level of awareness, which will obviously help continue to move forward.
So there's definitely a stigma about it. I mean, one of the big challenges is really the unpredictability of it. So people who have epilepsy um, tend to self-restrict. So many people can't drive if they're having frequent seizures. Seizures can be worsened by things like sleep deprivation and alcohol and stress. So people, I think, try to keep a low profile. And many people who have epilepsy also suffer from depression and anxiety. So that can that can affect you in and of itself and affect your life choices. So, you don't have to look back that far in the United States to see that people with epilepsy were treated very poorly. There's still a tremendous number of misconceptions about it. Even basic seizure safety is just starting to get out there. I talked to many people when I was working full-time clinically, and they still believed that people could swallow their tongue. Some people believed epilepsy was transmissible. So it's there's a lot of education to be done, and there's a lot of foundations right now doing the hard work of getting the right information out there.
Can you talk us through some of the things that you're doing with Eysz that help solve this problem?
Yeah, so the biggest problem, as we were chatting about before, is that with other disorders, for example, like diabetes, we have methods of tracking and understanding who's sick. So, for example, you would go to your doctor and you'd have all your glucoses and you'd have your hemoglobin A1C, and the doctor would have a pretty good picture of how their treatment is going, how your body is responding. In epilepsy, we basically ask the families to tell us how somebody's doing, or ask the patient to self-report. And the problem is that epilepsy is a disorder of the brain and a disorder of consciousness. So when someone loses consciousness, they may not necessarily remember that they had a seizure, yet we're asking them to tell us how they're doing over time. And so what that means is that even in the best case scenario, we know that at least 50% of seizures are missed. So someone with epilepsy would go to their doctor and give a report, well, since I saw you last, I had 2 seizures and maybe I'm a little drowsy. And the doctor would go, well, 2 seizures, did you miss your meds? Are you sure you had a seizure? Did you ever wake up in the middle of the night? Not sure if you had one. And you can just imagine what kind of a rabbit hole it is to try to understand what's happening. And then when you're then taking that information and making a clinical decision, I really felt like it was unfair to my patients. Like they didn't understand how much weight I was putting on their subjective description of what may have happened to, decide to switch meds, to start thinking about hospitalization. And, it's just, we're so behind in that sense. And another example is there's something called sudden death in epilepsy. It strikes between 1 in 100 to 1 in 1,000 per patient years. So it's not, in my practice, I would lose sadly 1 patient a year to this disorder. And they would be found dead in bed at night. And the problem is that I had no indication. One of my patients that passed away had successfully had epilepsy surgery 2 years prior and was seizure free, but now she was found dead in her bed. And I didn't know she was sick. Like, that's not right. Like, I should know that she was at risk. I mean, I knew that this could happen, but there's nothing specific about her that warned me, this patient is sick. Keep this patient on your radar. Instead, we're left having these conversations that we think are doing a good job informing our decision making, but they're not.
Yeah, that's horrible. It's a helpless feeling too, right? Because you feel like you probably could have helped her, but because there wasn't access to information to know whether she was sick or not at the current moment, how can anyone provide the help that someone needs, right? If you don't know, and that really goes with a lot of, and now I think we're much farther along in other spaces of healthcare. We have, gauges and checks. And this is a similar problem, I think, is what they're going through in the mental health space right now, is they're trying to build in those checks to understand, like, where is someone actually at? Because for a while, it was kind of like the Wild West, right? You didn't really know, who's depressed. And unless they're talking to you or there's certain signals, right, you don't know that information. So Interesting. Okay. Well, what I'm curious about, can you talk us through, I guess, with Eysz, what the future of this space looks like, and really, I guess, you don't have to share too much, but really what your vision is, ultimate vision is for the company?
Yeah, so we are basically developing a digital therapeutic. The concept is that we're leveraging existing eye tracking technology. So over the last 10 years, there's been a revolution in eye tracking. Eye tracking is embedded in multiple hardware systems now, including VR and AR headsets. It's becoming more and more powerful and accurate. It's in cars, et cetera. And the concept is we're taking this passive data from our spontaneous activity and analyzing it to get a window into the way the brain is behaving. In our initial market, we're really looking at a subtype of epilepsy that affects children predominantly called absence epilepsy. And kids that have this type of epilepsy have very brief episodes where they stop and stare, typically on the order of 10 seconds, at onset between 5 to 7 times per hour. So super frequent. And the problem is the episodes are so brief, parents can't count. The correlate of that is that the pharmaceutical companies can't count because the FDA uses seizure counts as the outcome to show that drugs work to treat something, right? So there's been no new medications in this space in 30 years because nobody can count these seizures accurately. So the concept is really that someone would be wearing our device. We would be able to get a baseline seizure burden, what their seizure count is, what their cognition is like pre-treatment. And then as treatment progresses, we would be able to follow them and see that, hey, this medicine's working, really minimal side effects, this patient's doing well, or hey, this medicine is kind of working, gosh, they're having a lot of drowsiness, this isn't working for them, let's try something else. And instead of having patients stuck in these prolonged treatment cycles, it's about getting them on the right medicine as quickly as we can so that they have a better quality of life and can return to normal activity.
What's next for the company?
Yeah, so we're currently running a clinical study out of 4 sites. We're taking our algorithms that we developed when I was at UCSF and refining them in preparation for a pivotal study that we hope to start early next year with the getting ready for the FDA submission by the end of next year. So the goal really is to get this initial absence epilepsy seizure monitor on the market in the next year with the plan of expanding to other seizure types and other neurological disorders. And the goal really is to provide treatment support so clinicians can make appropriate decisions or personalized decisions for their patients based on real data.
Very exciting. I look forward to continuing chatting with you and seeing the progress of Eysz, but thank you for what you're building. It's super interesting. You're going after a space that I don't think gets the recognition that it really should. And that was part of why we wanted to talk, right? We want to hopefully shine some more awareness on the problem that you're solving and make Eysz more known to the companies, other people out there in the space, both that have epilepsy and that are interested in learning about what the future of healthcare will look in all areas. So thank you so much.
Thank you for having me on. And we're also fundraising, so feel free to check out our website, www.eyszlab.com. And
I'll throw one of the links to, because you are doing part of your raise is crowdfunding, right?
Exactly. Yeah, the goal really is to make this accessible to the people who this is a challenge for or care about this, and to bring them along on our journey.
Perfect. Yeah, I'll throw a link for everyone listening in the show notes, so you'll be able to easily go check that out. But yeah, thank you so much for joining me on the podcast. Best of luck.
It was a pleasure, Jared. Thank you.